For me, when I start to address a patient that comes in, is I always find where all the kinks in that fascial system are at. But truly, if you have any type of fascial binding, let's say if you had it right here on the shoulder and the shoulder was giving a person a problem, then the first thing I do as my assessment is I go to all the acupuncture points around the fascial point. And I hope that makes sense. So that usually means that there's some kind of twist or turn in the fascia. So it's bound up like saran wrap. I always say when saran wrap, somebody crinkles it. So we know that. And what I do is then I always monitor all the acupuncture points around that area where it's blocked. Now, in Chinese medicine, the arena I really love to dive into is if I looked at a person who had a shoulder problem or complete shoulder block, I don't just stop in the fascial area. I do know it's a large intestine issue if that's where the point is at, but my mind first goes into what are the stress indicators or the psychological, emotional aspects of the large intestine. And that may sound like we're reaching, but truly to me, is if a person has a large intestine blockage, not maybe physically, but emotionally, I always correlate, like you and I do, to Chinese medicine emotions